Diabetes mellitus, commonly called diabetes, is a chronic metabolic disorder characterized by elevated blood sugar, glucose, levels. There are several factors that contribute to developing diabetes. The causes of diabetes can be broadly classified into three categories. 1. Type 1 diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system mistakenly attacks and destroys the insulin-producing beta cells of the pancreas. The exact cause of this autoimmune reaction is not fully known, but genetic and environmental factors, such as viral infections, are believed to play a role. 2. Type 2 diabetes. Type 2 diabetes is primarily caused by insulin resistance, where the body's cells do not respond effectively to insulin, causing blood sugar levels to rise. Several risk factors contribute to developing type 2 diabetes, including obesity. Excess weight, especially abdominal obesity, increases the risk of insulin resistance. Lack of physical activity. Lack of regular physical activity can lead to obesity and insulin resistance. Unhealthy diet. A diet high in refined sugars, saturated fats, trans fats, and low in fiber can lead to obesity and insulin resistance. Genetics. A family history of diabetes increases risk, suggesting a genetic predisposition. Age. The risk of type 2 diabetes increases with age, especially after age 45. Race. Certain racial groups are at higher risk, such as African Americans, Hispanic Americans, Native Americans, and Asian Americans. 3. Gestational diabetes. Gestational diabetes occurs when the body does not produce enough insulin to meet the increased demands during pregnancy, causing blood sugar levels to rise. Risk factors for gestational diabetes include obesity. Overweight women are more likely to develop gestational diabetes. Family history. A family history of diabetes increases your risk. Age. Women over 25 years of age, especially those over 35 years of age, are at higher risk. Race. As with type 2 diabetes, certain racial groups are more susceptible. Other causes and types. Secondary diabetes. Some medical conditions, such as certain hormonal disorders, pancreatic disease, and drugs, such as corticosteroids, can cause secondary diabetes. Monogenic diabetes. This rare form of diabetes is caused by a mutation in a single gene and is usually diagnosed in childhood or early adulthood. Most asked questions about causes of diabetes. What is diabetes? Diabetes is a chronic metabolic disorder characterized by elevated blood sugar, glucose, levels. There are different types of diabetes, including type 1, type 2, and gestational diabetes, and each has its own unique causes and risk factors. What causes type 1 diabetes? Type 1 diabetes is an autoimmune disease in which the immune system mistakenly attacks and destroys the insulin-producing beta cells of the pancreas. The exact cause is unknown, but genetic and environmental factors, such as viral infections, are believed to play a role. What causes type 2 diabetes? Type 2 diabetes is primarily caused by insulin resistance, in which the body's cells do not respond effectively to insulin. Risk factors include obesity, physical inactivity, unhealthy eating habits, genetic factors, age, and race. Can diabetes be inherited? Yes, having a family history of diabetes increases your risk of developing diabetes. However, lifestyle factors also play a role, and healthy habits can lower risk even for individuals with a family history of the condition. What is gestational diabetes and what causes it? Gestational diabetes occurs during pregnancy when the body does not produce enough insulin to meet increased needs. Risk factors include obesity, family history, age, and certain ethnic backgrounds. It usually resolves after giving birth, but increases the risk of developing type 2 diabetes later in life. Can lifestyle choices affect your risk of developing diabetes? Yes. Adopting a healthy lifestyle, including regular exercise, a balanced diet, maintaining a healthy weight, and avoiding tobacco and excessive alcohol consumption, can significantly reduce the risk of type 2 diabetes. Are there certain foods that can cause diabetes? Although there are no specific foods that directly cause diabetes, sugary drinks, processed foods, and a diet high in unhealthy fats can increase the risk of type 2 diabetes by causing obesity and insulin resistance. Can stress cause diabetes? Long-term stress can temporarily affect blood sugar levels, but it is not a direct cause of diabetes. However, managing stress is important for your overall health and well-being. Can diabetes be prevented? Although some risk factors, such as genetics, cannot be changed, you can significantly lower your risk of developing type 2 diabetes by adopting a healthy lifestyle. Regular exercise, a balanced diet, and maintaining a healthy weight are key preventive measures. Is diabetes treatable? There is currently no cure for diabetes. However, it can be managed effectively with appropriate medical care, medication, in some cases, and lifestyle changes. Early diagnosis and appropriate management are important to prevent complications caused by diabetes and lead a healthy life.